Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello, and thank you for coming back this week for another episode of the Wellness Optimizing Warrior MD podcast. In today's podcast episode, I plan to continue the conversation around monitoring testosterone therapy levels, which I started in the last episode. And I'm going to start this episode with a little recap, just in case you didn't listen to last week's episode, which I encourage you to go back and listen. I did speak about the difference between a normal range testosterone level issued by the lab versus an optimal testosterone level, which again, I'm going to point that out, but I did make a point about this in the last episode. The optimal levels for testosterone in women are unknown. And last but not least, testosterone therapy levels, which are most of the time supraphysiologic levels, meant to achieve a specific purpose: repair and restore the body. And in this episode, I'm going to dig a little deeper into what is a supraphysiologic level and what does that mean for a woman. Last week, I explained that normal range testosterone in women could be as low as 2 and as high as 45. And I took Quest range just to kind of as random pick, but I do use Quest a lot. And I explained that according to Quest, testosterone level of 46 and beyond will be considered out of range. Now, that is not necessarily abnormal, and it should be interpreted with caution and questioned as whether or not it is inappropriately high. I also made the case that the statistical analysis executed by the lab researchers that determined the appropriate ranges for reporting values for any tests, including hormone levels, might be based on the wrong statistics, because the majority of women that are tested for testosterone, if that's what they're using, we don't know what they're using, nobody has told us. When testosterone is tested, it's already tested because of a hormonal deficiency symptom. So hundreds of thousands of women, if not millions of women, are being tested for testosterone because either they asked to be tested because they thought they have a low testosterone problem, or because their symptoms, when they presented to their doctor, indicated a deficiency of testosterone. And the doctor decided and recommended that they should be tested for testosterone, as low testosterone was suspected. So all of these women that are tested already have low testosterone. I also discussed last week how optimal testosterone level is a big unknown, because ideally, we should test each woman at the peak of their youth in their 20s or early 30s when they feel their best, when they have no mental, no physical or emotional health issues. They're not on any hormonal birth control. Then we can use testosterone level as a possible health marker or indicator that could also be used as a reference point. I did explain in the last week episode that the hormonally deficient woman in her 50s, 60s, and beyond has significant changes in her body that will require supraphysiologic levels of testosterone in order to achieve the desirable effects of improving muscle mass, improving bone mass, and helping to prepare and restore the body's capacity closer to norm. I did post a video on social media about the testosterone levels, and I received very many interesting responses, which indicated to me that I need to spend a little time discussing this whole supraphysiologic topic. Now, you might wonder about this term that I've recently introduced in the last podcast episode, supraphysiologic. It's a very simple term, but with a very ambiguous meaning, ambiguous clinical meaning. So I'm going to try to explain the term to you, as well as I hope you can make sense of it in your mind Because where testosterone is concerned, it's very impactful for you, my listener, when you understand a little bit about testosterone levels and how testosterone therapy should be managed and what are we striving for in matters of levels and clinical response. So very simply put, supraphysiologic or super physiologic, but it's supraphysiologic, means above physiologic levels. In very simple terms, breaking it down to the basics, if you have testosterone levels in the supraphysiologic range, that might be desirable, but this is only for testosterone. As testosterone is very unique in terms of how its supraphysiologic levels can be beneficial for women, especially for women, but for men too, but we're talking about women here, right? However, supraphysiologic is not something we aim for or we wish to achieve for other hormones, specifically hormones like estrogen or insulin. So why is testosterone unique in this matter? Why do we even consider or want, or we're talking about supraphysiologic levels? Because testosterone has the unique and outstanding role of being the major anabolic hormone in the human body. This goes for men. It also goes for women. Anabolic hormone means it has the ability to repair, restore, and regrow damaged or deficient tissue like muscle, bone, skin, etc. If your normal physiologic level, which means the level that you get tested, and here's the result, this is what your testosterone is. Let's use 25 as an example, right? Your testosterone level is 25, so it's somewhere between 15 and 30. There is a little bit of a variability. So anything above 25 to 30 would be supraphysiologic to you. Now, as a recap from last week's episode, normal range is something the lab picked up and established based on probably what they likely believe is the statistical data analysis from tens of thousands or hundreds of thousands of samples for testosterone level in women. And unfortunately, as opposed to estrogen, there's no difference when they report testosterone based on a woman's age. So you think a testosterone for a 20-year-old, it's more than a 30-year-old and definitely more than a 40 and 50-year-old? You're right. But that's not being reported that way. Now, Quest has chosen a normal testosterone with a minimum range of 2, just slightly above 0, and a maximum of 45. There is no textbook of medicine that I have studied, that I know of, that I'm aware of, that describes a testosterone level of 3 or 4 or 5 as being normal. Rather, we are presented with a range. So the problem with testosterone levels in women is the fact, and that applies to men too, but it's the fact that many doctors accept the status quo of what the lab is reporting. And they don't bother questioning or looking deeper or further than what they see on the lab report. So as a consequence, a lab hormone level range already establishes a level of authority within the medical community. Well, why? Because doctors who are not trained in hormone replacement therapy have no knowledge of anything other than what this range that the lab is telling them the hormone should be in. The lab range reported is their Bible, is the golden standard, is their personal go-to reference. By giving the lab this authority and by accepting that the normal range established by the lab is the doctor's Bible, gold standard, etc., it goes without saying that a higher than 45 testosterone level is automatically raising some alarm bells in the mind of the doctor and in the mind of the patient as well. The lab, Quest, LabCorp, Pacific Diagnostics, whatever the lab is, that range that has been chosen to be reported as the normal range for testosterone levels in women has become a medical community influencer, as well as an influencer of public opinion. The patients get their blood test results sometimes before the physician gets to talk to them, and they have questions. They've already been the rabbit hole of Dr. Google. They've already looked it up, and they come to you and they're like, I got PCOS, I got a tumor. What is wrong with me? And their testosterone is 47 or 50. What is more interesting is they fail to question a testosterone level of 5 or 10 or 15 because they see it in range. So it raises 0 alarm bells, and patients make no connection between their testosterone levels and also their loss of stamina, loss of endurance, loss of energy, loss of muscle mass, weight gain, loss of motivation, ambition, and drive, and last but not least, loss of desire for intimacy with their partner. I am pretty confident that the lab entity that chooses its level of normal variance, the reported range for the hormone level, specifically testosterone, is not doing so in order to influence public opinion or medical opinion. But they do it anyway, even though this is not their main intention. They do mention this is a reference range, and it should be discussed with a trained specializing physician in this area, but no one reads the disclaimer. The patient doesn't read it, the doctor doesn't read it. So let's come back to the conversation about supraphysiologic levels. I explained in the last episode that ideally, when you're healthy at the peak of your sexuality, at the peak of your fertility performance, your mental health, and emotional well-being, when you feel your best, when you're young, you should get tested for your hormones, including all your sex hormones. So both you and your doctor understand what is the level that's the starting point, that's the reference range for you. I also explained in my last episode and in previous other episodes and on my social media that no one does this. Patients don't do it, don't request it, and doctors don't do it. This is not standard of care, but it should be. We are not looking and tracking testosterone levels throughout a woman's life, but we should. Now, I really hope that whoever listens to my podcast will spread the word and pass this opinion along. So change, meaningful change, can be driven by demand for services. And the patients, you, my listeners, who are ultimately the consumers of the healthcare industry, will start demanding that their testosterone levels are checked early on in their 20s and ideally every year thereafter. Hopefully, when that happens, more and more doctors will be interested to know more about the testosterone in women. What is up with this enigma? They would like to know more about optimal levels and how maybe, and how to use testosterone to restore and maintain an aging and imbalanced body. So I will tell you again that the medical community has no idea what an optimal testosterone level is. And let me talk more about that. Very likely your personal optimal level could very well be above the normal range that is decided by the lab that your blood gets sent to by the doctor. So what is an optimal level, specifically when we use testosterone therapy for women? Well, an optimal level of testosterone is a level that would allow your body to respond well to the therapy. So an optimal level is the level at which your body will improve its stamina, its endurance. It will improve your motivation, drive, ambition, and performance during athletic exercise. It will be the level at which you will be able to speed up your recovery from strenuous exercise, the level at which you can improve your mood and mental clarity on testosterone therapy. It would be the level at which it will help you reset and speed up your metabolic rate while allowing you to build muscle and burn fat. And last but not least, it will be the level at which you will be capable to feel an improvement in your sexual desire and more interest in being intimate with your partner. All of these are desirable outcomes for testosterone therapy. So an optimal level would be a level that gives us this with no side effects or minimal side effects. This optimal level is going to be very different from woman to woman. You realize I have not mentioned any numbers. I've encountered women who feel great as soon as their testosterone level is slightly above 50, maybe 50 to 70. And I have seen women who do not feel improvement until their testosterone level is above 200, maybe way above 200. Let me try and build a visual analogy to help you understand this idea of an optimal testosterone level. When your body finds itself deficient from a well-being and wellness standpoint, it means your body is in a hole, a deficiency, a state of minus, a state of loss of well-being, from which it needs to climb back out and come back to the surface, come back to the floating optimal line. This is just like being in a hole that you have to climb out of. This imbalance, let's call it the hole, can be superficial for some people and very deep for other people. Now, if the hole that you have to climb out of, the deficiency, is superficial, the deficiency is not severe, is mild, you can simply climb out with a boost in the right direction, with the right tools and the right strategy. It won't take a lot of effort. If the hole and the deficiency you are in is much deeper, if the deficiency of the well-being you're experiencing is much more severe, then you will need a very tall ladder, ideally provided to you by someone that is willing to help you climb out. This ladder will have different rungs, let's call them steps, and maybe each step is a representation of a different kind of therapy that you will need to get out of this deficiency. But believe me, testosterone therapy, especially if you have testosterone deficiency, could be an extremely valuable step on this ladder of climbing back up to optimal physical, mental, and emotional well-being. Let me use a little bit more of an analogy along the lines of the ladder that's needed. Just like a step on a ladder will take a light weight very easily, even if that step is fragile, you will not need much testosterone to improve the well-being of someone who is only superficially deficient in many aspects of their life and wellness and well-being. But just like a step on a ladder will crack and crumble if the weight bearing upon it is more than it can handle, so will testosterone therapy fail if it's lower or moderate dose and it's aiming for lower or moderate levels when it is used in a severely deficient individual who has severe deficiency symptoms and who finds himself or herself, but it's mainly herself because we're talking about women here, deep into the minus range due to a multitude of medical issues and in the background of significant multiple problems. Now, here's the thing. Many people doubt the power of sex hormone therapy, especially estrogen and testosterone therapy for women, to pull you out from a deep deficiency of wellness and well-being situation. And that is where our obstacle lies for the physicians who believe in the healing power of hormones, who do their best to try and overcome the public opinion that has been formed over the past 20 years and hangs like a cloud over the reality of hormone therapy, specifically sex hormone therapy, testosterone and estrogen included. Obviously, at the center of this reality distortion is estrogen for women. But more so because of this controversy around estrogen, you think that testosterone should be the next best thing, but it isn't. There are many reasons for that, but let me stay on point for what we're talking about here, about the levels. Now, remember when you were young and you would party all night, Friday, Saturday nights, and barely had a chance to recover on Sunday before you had to show up to work on Monday? And you did it just fine. Now, if you're in your late 40s or 50s and beyond, do you sincerely believe you have the stamina and endurance to do the same? No, you won't. And you won't be capable to, because one of the main pillars of your stamina, endurance, and strength were your sex hormones and your adrenal gland. And of course, your youth and its vigor. But now your hormones and your youth, they're both gone. But sex hormone therapy, testosterone included, or testosterone only, if needed, could help that situation and restore some of the vigor that you had when you were younger. So by this discussion, I hope you are closer to understanding the terms normal range, optimal, and supraphysiologic, as pertaining to testosterone therapy for women and in general. Now, I would like to continue the discussion about monitoring testosterone levels when a woman is on testosterone therapy, because this is what I promised to do in this podcast episode. And what is the best timing of checking testosterone levels if a woman is on a specific therapy? And does it matter if a woman is using testosterone cream, testosterone injections, or she's getting testosterone pellets? These are the three available modalities to introduce testosterone hormone in the form of testosterone therapy into a woman's body. A daily cream, an injection usually administered every 3, but mainly every 7 days, so it's once a week, or by pellet insertion. Let me talk about monitoring testosterone levels when a testosterone cream is being used. If you apply a daily testosterone cream, and this is the reality and this is the truth of bioavailability, your testosterone levels will surge into your bloodstream, achieving a peak, and there will be a pretty big and fast dump of the testosterone immediately after the cream application within 2 to 3 hours. So the presence of testosterone in your body will last maybe another 4 to 6, 8 hours max, during which the body clears all this testosterone and is going to shift it into various metabolites. And the body's job, and it does it really well, is to get rid of it from the circulating blood very quickly and squirrel it away into the tissues. If you're applying a testosterone cream daily, your testosterone levels will have to come back to your normal low baseline before you apply your next dose, which is usually the next day in the morning. Usually, testosterone levels return back to normal in less than 12 hours from the topical cream application, which means you have some testosterone for 12 hours and none for the remaining 12 hours. You also get a surge that lasts 1 to 2 hours, followed by a constant and steady decline in testosterone levels back to baseline, which happens in the next 4 to 8 hours after the peak. So checking your testosterone levels 1 to 2 hours after you have applied the cream will indicate how high the testosterone levels are surging. What is the peak with this application? If you'd like to know how high testosterone is with this modality, do a blood test 2 hours after you have applied the cream. That shows you maximum testosterone exposure. I usually recommend patients check their testosterone levels either at 6 or 8 hours after the cream application, because I expect that by 8 to 10 hours, the testosterone level is most likely going to be very close, if not already back to baseline. Many times patients forget about the timing for the testosterone blood level. They combine this test with other blood tests that they have received from another doctor. They only want to go to the lab one time. Why would I need to go multiple times? I understand that you as a patient would like to minimize the time you spend at the lab, and you do not want to go to the lab multiple times. And you probably don't think it matters, but it does matter. Let me give you an example. Your primary care doctor, your cardiologist, has ordered a lipid panel, a CBC, and a metabolic panel, and all of those have to be fasting. You show up at the lab and you hand the phlebotomist all the orders, including the order for testosterone that you received from your hormone therapy doctor. Very often, women forget about the timing. They're just focused on getting the stuff done. I got all these tests to do. I only have this much time. Let me combine them together. So they go in the morning and fasting, as all good patients do. Now, the patient is 1 to 2 hours after the testosterone cream application. She was a very good patient. She applied the testosterone cream as she should. So guess what? The lab will detect a surge in the testosterone level. And it could be as high. The highest I've seen was 900. Believe me, I have seen that. So that's an optimal range of testosterone for men. Now, if the patient would test her levels as indicated by the hormone therapy doctor at 6, 8, 10 hours, it would be significantly lower, likely way below under 100, as expected. So there would be no danger that the testosterone will be too high in the morning when she applies it again, and will give the doctor an idea, okay, well, what are we dealing with here? How much is this testosterone dose she's in impacting her? Now, you're going to say, wait a minute, what about the 900? That is a very high testosterone level. And you're right, it is a very high testosterone level. And I have seen testosterone levels consistently above 400 in women who use testosterone creams. And who get tested close to their administration time. So the highest I've seen was this 900. And of course, when I asked the patient, hey, what happened? She admitted she totally forgot she had to go to the lab in the afternoon. So I asked her, hey, in order to manage your cream better, I really need to know what it is 8 hours after you put the testosterone cream, not an hour or two later. She did, and her testosterone with the same dose was 40 after 8 hours. After this small little snafu, the patient was finally aware that her symptoms and this daily surging of testosterone levels was not necessarily the best option for her, and she switched to a different therapy, which she is extremely happy with and has not looked back since. Now, this doesn't mean testosterone topical cream application is bad. It simply means it has to be interpreted carefully, managed carefully, and in my humble opinion, surging any hormone levels is not ideal or optimal because there's a very high chance that undesirable hormone metabolites might be clogging a woman's pathways because of this phenomenon of surging levels. It is a limitation topical testosterone therapy has, and it really has to be taken into consideration when explaining all the options. It is easy, and if you don't like it, you can just stop using it. But most women like to do what they like to do. Another possibility is to apply testosterone therapy at bedtime and check hormone levels in the morning. You can still use your testosterone cream in the morning. Go ahead and apply it in the evening for the purpose of testing. And then you go to the lab with the test from the cardiologist and the primary care doctor for all the other stuff. Now you can do it all together. This would be about 10, 12 hours from the cream application. It will tell the doctor what is happening with your testosterone levels at the halfway point between the beginning of the day and the end of the day, which is the interval at which you are applying the testosterone. Now, when do we test testosterone levels for women who are using injectable testosterone? Some women prefer to use testosterone injectable therapy. Now, this podcast is not about pros and cons of different therapies. However, I should mention here that the injectable testosterone is usually testosterone cypionate, an ester form of testosterone, which will have to be converted by the body into actual testosterone. So injectable testosterone therapy is not bioidentical, but it works, and women are pretty happy with it. We are not introducing a bioidentical hormone into the body. So, and that's a key thing. Like personally, I would never want that for me, and I haven't tried it myself. But if you're on testosterone injectable therapy and you decide to monitor testosterone levels after the injection, you can test for the peak, the surge, in 24 hours from the time of the injection, or you can wait 3 days and see what the testosterone level would be halfway between the two administrations, because testosterone injections are usually about once a week. Or you can test right before you give another testosterone injection, which would tell the provider if your testosterone levels have come back to the baseline, so you don't overdose or stack. Obviously, this is very different for women who are getting testosterone replacement for the pellet insertion. Their testosterone levels need to be checked very differently. The timing is different. Testosterone pellets are compressed, very small, bioidentical little pellets that contain testosterone, pure testosterone with stearic acid to bind it together as a binder. That's it. It is pretty small, and it's inserted into the upper back hip after making a very small incision into the skin and threading the trocar. The trocar is basically a 3.5 millimeter diameter hollow needle that's got a pointy, sharp tip so it can allow the penetration into the subcutaneous tissues. Usually 1, maximum 2 pellets, depending on the dose, are inserted and deployed underneath the skin into the fat tissue, at least 1 centimeter below the skin. The testosterone released from the pellet therapy is released due to an internal release mechanism, which is your beating heart. Your heart beats, pushes the blood to the pellet, and it comes right back from the pellet to the heart to be distributed to all the organs. So there's this established connection between your heart and the pellet via the bloodstream, and you have a constant, steady release. That is the uniqueness and the reason why pellet therapy can have such outstanding results. because it mimics nature. And when your ovaries produce testosterone or your adrenals produce testosterone, they're not producing it in spurts. They're producing it in a constant, steady fashion, minute by minute, hour by hour, day by day. So the testosterone release from the pellet will reach the peak of release in about 3 to 4 weeks. Will then stabilize at about 5 to 6 weeks till to a level that's going to be steady for the next at least 2 months, probably 2.5 months, after which it will start declining as the pellet is biodegradable and gets smaller and smaller as it's being eaten up and dissolved by the bloodstream. So testing at 5 weeks or so is looking at the post-peak testosterone levels. If you test at about 8 weeks, you're testing right in between the two administrations. That is the level at which you are cruising. And if you're testing about 1 to 2 weeks before another insertion, then we're looking at the levels that are there before we add another pellet in order to avoid the risk of stacking or overdosing. Just like the cream or the testosterone injectable therapy, you want to make sure with the pellet that the testosterone levels have dropped into a zone that makes insertion of another pellet safe. Now, understanding the bioavailability of a specific hormonal method on the part of the physician and therefore managing the hormone therapy is absolutely crucial so that the hormone levels are interpreted correctly and usefully, not just for the safety of the patient, but also for the benefit of the patient. So let me talk a little bit about DHT. There is some concern that elevated supraphysiologic testosterone levels can cause side effects because increased testosterone levels can shift the testosterone into its metabolite called dihydrotestosterone or DHT. I call it the skin testosterone because it mainly promotes hair shedding and male pattern baldness by binding to hair follicles and causing them to shrink. And unfortunately, they eventually stop producing hair if they get exposed to DHT over and over and over again. In women, elevated DHT, dihydrotestosterone, can cause hirsutism, which is excessive hair growth on the face and the body. Also in women, DHT is responsible by stimulating the sebaceous glands of the skin to produce sebum. Sebum is a very important oily substance that allows the skin to remain lubricated and moist. But excess sebum caused by too much dihydrotestosterone will lead to acne breakouts because it will clog the pores, especially in the woman's jawline area, which is much more sensitive to DHT, leading to hormonal acne. That is easily how spironolactone, a medication that's widely available and rather safe in using, with few exceptions, this is how we manage to keep testosterone level in an optimal supraphysiologic range and not have side effects. We have tools, and spironolactone is one of them. In the presence of intolerance to spironolactone, then there are herbal products like saw palmetto or chrycine that can be used. A little weaker results, but still very, very useful, including DIM. So keeping testosterone levels steady, coming back to testosterone levels, keeping them steady, not surging, not up and down, and keeping them in an optimal range is important, not just for optimal benefits, but also to avoid side effects. And again, side effects can be managed, can be controlled, and can be avoided and minimized as long as the physician is aware early on that they are happening or is informed that the woman receiving the therapy has been prone to acne, hair loss, or excessive hair growth. If a woman waits until her next visit to complain that I hate this testosterone thing, it gave me acne and a mustache, but it does make me feel good, but I just don't like the way I look, there's no need for that. You need to call as soon as you notice the problem. Make an appointment with the doctor, sit down and tell him about your problem, and he will fix it, or she will fix it. So, if anything, I sincerely hope that this podcast episode is going to raise some questions about trusting anything and everything you hear regarding hormone levels, and make you think for yourself and perhaps choose to discuss your hormone levels, especially when you're undergoing testosterone therapy, with a doctor that is trained in testosterone therapy. Not like any doctor, not your primary care doctor, not your cardiologist, who unfortunately are probably clueless, and they simply refer to the range provided by the lab as their Bible of interpretation and categorization. So anything outside of it becomes a problem and is presented to you as a problem, generating unnecessary anxiety and stress. So please take with a grain of salt everything you hear regarding hormone levels, estrogen, testosterone, progesterone, from someone that is not trained in hormone therapy and does not specialize in hormone therapy. Say thank you for the information and go back to the trained physician who can explain the results and then outline a treatment plan modification for you or an adjustment in your dosage if necessary. On the other hand, please know that there's a lot of information presented out there online, on social media, and by doctors who is not really vetted or supported by any specific research. And a lot of it is based on anecdotal or observational experience without a ton of research. So the next question that you and I should be asking ourselves and the people in charge of research is, why is there no significant research on this topic, testosterone therapy in women? That's a great question. I will address that in next week's episode. And I don't want to leave you hanging, but please come back next week. I will talk more about pearls regarding testosterone therapy, and I will tune in to this lack of research in women's health and specifically hormonal health issues. And as always, I am super grateful you allowed me to be in your ear providing information about such a valuable health topic like testosterone therapy and monitoring testosterone levels. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.